Hi, my name is Emily, and this is my flashcard on ulcerative colitis. So, ulcerative colitis is a type of inflammatory bowel disease, or IBD, in which inflammation of the lining of the intestines causes frequent diarrhea. The exact cause of ulcerative colitis, or UC, is unknown, but there are several identified risk factors. UC typically occurs in the large intestine towards the end of the GI tract, and can be solely confined to the rectum, called proctitis, or can extend to the sigmoid colon and even to the descending colon. Disease typically starts in the rectum and progresses up the GI tract. Due to the inflammation, ulcerations develop, and as part of the healing process, granulation tissue forms. However, this tissue is fragile and easily bleeds, leading to blood in the stool. Because of the loss of integrity of this tissue, fluid and electrolyte absorption is impaired. Onset of symptoms is gradual, typically progressing over weeks to months. The disease course involves times of remission with effective treatment and occasional flare-ups or exacerbations. Two serious complications of UC are toxic megacolon and colorectal cancer. And toxic megacolon occurs when peristalsis is affected by the inflammation and therefore obstruction of the colon occurs. So risk factors for developing ulcerative colitis include increased dietary intake of fat, poor sleep, and a history of recent gastroenteritis. NSAID and oral contraceptive use potentially increase one's risk of developing UC by a small percentage, and Interestingly, an appendectomy and a history of smoking both have been shown to lower the risk of developing ulcerative colitis. The onset of disease is typically from age 15 to 30 years old. Males and Jewish individuals have a slightly higher chance of having UC. Family history of inflammatory bowel disease, such as UC or Crohn's disease, also puts patients at a higher risk for this illness. Some major common signs and symptoms of UC are frequent watery diarrhea, sometimes with mucus or blood, up to 10 or more times per day in severe cases, urgency with bowel movements, and abdominal pain or cramping. Patients commonly have a low-grade fever as well. If patients present with bloody stools, they may also have anemia. Systemic signs or symptoms of anemia are fatigue, pallor, tachycardia, dyspnea, and palpitations. Muscle wasting and weight loss are also common in those with UC. For diagnostic testing, laboratory studies of a patient with UC would show an elevated ESR due to inflammation, anemia shown by low H&H and a CBC due to bleeding, low albumin and electrolyte abnormalities due to impairment of nutrient absorption. An endoscopy of the GI tract is needed for diagnosis. It will show active inflammation of the mucosal lining with associated ulcers. Providers typically take a sample of tissue for biopsy to confirm this diagnosis. And so from this image here, as you can see, you can compare the normal lumen of the colon in normal intestines, and then right below that is the colon wall in ulcerative colitis with continuous inflammation throughout, specifically the rectum and the large intestine. And these are my references. Thank you very much for listening.